So question number one, what advice would you give a student trying to pursue a career in public health?
I would just say that if you can find somebody that is doing work that you are interested in, hold on to them for dear life and try to suck all the information out of them that you can. It's just, it's always good to have a mentor, whether it's a professor or somebody a little older than you know, a second year student versus a first year. Just and don't be afraid to ask questions. So that comes with that. So find somebody that you're comfortable with, that you like the work that they're doing, and ask them as many questions as possible. That'll help you to kind of differentiate what you like, what you don't like, and where you want to go. Um, and and if you can find two people, three people, do it with as many people as you can, because that'll definitely make you a wiser person for sure.
Okay, yeah, and I definitely think being curious, especially as public health isn't really understood, and there's a lot of different things that go into public health, being curious to understand what people are doing can be extremely helpful.
Yes, exactly.
So, number two, if you were talking to someone wanting to get into your position, what advice would you give them?
So speaking on the position that I had in Florida, um, I feel like also depending on where you live, having a second language is amazing if you can do it, or be conversational in it. In Florida, that's just necessary at this point. Um, Also, just if being very invested in your classes. Every single class that I took, I had to put into action once I was in the position. So, you know, in that interview, I was able to speak on different projects or different things that I had done that, you know, resonated or what was a small part of what I was going to be doing in that position. So take your classes seriously. Um, and what else? Network. I mean, really under, understanding that those mentors, those relationships, that could be the difference between you getting the position and not. Um, so whether it's, you know, my position at Will Florida or the position that I got um, here for the MPH program, um, being versed in public health is important. Having those mentors and connections is important. And, you know, whether you're in courses or there's a seminar you can go to or something online that you can attend that will just keep you up to date on what's going on in public health is important.
Yeah, some invaluable advice there, everyone. Number three, what's something you're working on improving in your life right now?
Reading. I feel like I've gotten out of touch with reading, and it was something I have enjoyed. Um, and now, you know, with audiobooks and podcasts and things like that, I just informing yourself, but also just picking up a book and looking at words and, you know, looking up words if you don't know what words are, you know, what that word means. That's something that I'm trying to work on. Um, More and more and things. There's definitely books that have been recommended to me that, you know, have a lot to do with what's been going on the past uh, weeks, months. So, and I have kind of like a fire for it right now, and I don't want that to go out. So, being up to date and reading is just something that I think would be just, I need to take advantage of it right now.
Okay. Well, I hope you're able to start reading soon.
I
So
did.
now,
I started like a week ago, so.
okay, awesome. Let's keep it up then. Awesome. So number four, professionally, do you recommend anything?
So I think yes. So anything Malcolm Gladwell, I love. That's something that my mentor basically kind of put me on. One of his podcasts that I really like is Revisionist History, where it's basically that he goes and kind of uncovers topics, revisits topics that have been forgotten. So it just, and the topics vary. One topic was Toyota Camrys, another one was like a rally and what happened in that rally. So he just kind of goes back and investigates those and finds out what really happened and why that situation happened. I say that professionally in the sense that it gives you a little bit of everything. So, depending on if you're on an interview or if you meet somebody new and you need to strike up, sorry, a conversation, or if somebody's talking about something, you're going to have something to contribute. Just because there's something that Malcolm Gladwell said that you're going to be able to just insert into that conversation, and it grows into something else. So personally for yourself and professionally, so you can just converse with people and get to know people and connect with them on a different level.
Okay, and I'll definitely have to check that out.
Yeah,
Revisionist history. It sounds very cool and interesting, and gives like
his voice is so like, I don't know, I wouldn't say soothing, but if I wrote a book, I would want him to record it for me, because it's just a very engaging voice that he has, and he's the one that does his own audiobooks and his podcast. So
Okay, awesome. So I'll definitely put that on my list to check it out, and I will leave that in the show notes for anyone. So, last question, where can people connect with you?
yeah, so you can email me directly at kattypiz@phhp.ufl.edu. Or we have our UF MPH Facebook, and I'm the one that posts and is typically the contact person for the Facebook, and that is UF MPH on Facebook.
Okay, great. Thank you. And I'll definitely leave all of this information in the show notes. So this is the conclusion of our show today. I am very happy that I got to talk to Katherine both about the public health bachelor's program, the master's program, and about her journey in public health. I look forward to seeing what she has in store for us going forward with her nursing in public health. And I just really enjoyed this conversation. So definitely feel free to reach out to Katherine if you have any questions about UF's bachelor's or MPH program, and she would be more than happy to help you. So thank you so much, Katherine, for being on today. I will
My
talk to you sometime soon.
pleasure.
Yeah.
Yes.
Take care.
Bye.
Bye bye.